everybody, I'm Dr. Matthew Caviola.
And I'm Dr. Mahbouba Hashemi. So in the previous video, we talked to you a lot about chronic disease and specifically its relationship with your immune system, especially in these days. We all want strong immune systems. So if you haven't seen it, go back to the previous video and watch that, and then come back to this one. But to give you a brief summary, so we define chronic disease. What is chronic disease? Diseases that come or develop over time. And we gave examples, and those were heart disease, high blood pressure, diabetes, cancer, obesity, aches and pains, autoimmunity, in case I haven't mentioned it, and fatigue, low energy. So a lot of these things that some of you might be actually experiencing. And we talked specifically about what are our approaches in our practice. And we talked about the fact that we discussed the concept of longevity and how this conversation is incomplete if we're not taking a look at both lifespan and health span. So what do we mean? Lifespan being extending your life and health span being improving your health. And we want to make sure that we're covering both, because just extending your life, which a lot of times, unfortunately, we see in mainstream medicine, just giving you an extra few more days or months or years without really addressing the quality of your health during that time is really suboptimal.
Definitely. Last time we had promised you that we wanted to educate you about where chronic disease comes from to begin with. And last time we had mentioned a few times, hey, listen, chronic disease does not just come out of thin air. It's not just something that comes overnight, right?
Yes.
Chronic disease is something that is developing inside you essentially for years. And so when we talk about chronic disease, we first have to kind of talk about, hey, how is health? You know, health runs kind of along a spectrum, right? You're either healthy, you're inflamed, or you're diseased. So this middle part, the inflammation part, is really what's lurking behind the scenes on a daily basis. That's essentially accumulating inside of your body on a daily basis that eventually leads to chronic disease. And so when we talk about chronic disease development, first and foremost, that spectrum that I just mentioned is a continuum. You know, it doesn't just happen in these segments. You know, it's basically there's a continuum along the way that is essentially you're healthy and kind of inflamed, and that inflammation piece is where you're starting to develop some of the symptoms of chronic disease, things like that you mentioned already, you know, fatigue and these aches and pains. All these are warning signs that your body, there's something going on inside your system, right? Those are the signs of inflammation, and inflammation essentially is supposed to be healthy. It's supposed to be a mechanism by which your body repairs itself, but over time becomes misaligned, and eventually your body starts to accumulate this inflammation over time, and your body can't regulate it very well. And then over time, that eventually leads to chronic disease development, unfortunately. So where does this inflammation begin? You know, we as naturopathic doctors are really passionate, super passionate about looking at gastrointestinal health, the gut, as a primary starting point, focal point of the beginning of inflammation. You know, we feel like 70% of the ball game, 70% of the beginnings of inflammation start in the gut. So if we can look at a patient's gut health, that is really, really important to understand the overall health. What's going on here in your gut usually translates outward, and that's really where we oftentimes start.
And also, a lot of where we start, and over the videos we'll talk to you about that, where we first and foremost start with patients is with their lifestyle. So we love defining terms, because then when we're referring to them, we're not assuming that you know and you already have a background. So let's talk a little bit about lifestyle medicine. Lifestyle medicine is basically using lifestyle factors, choices, to prevent, treat, or reverse chronic disease, exactly what we're talking about. And over time, we will touch upon a number of them. But in this case, you know, it's not just about putting in the good things that can improve your health or make your body thrive, which is absolutely what we want, but it's also about taking away the fire, which leads to chronic inflammation.
Yes.
And also, or taking away those things that, as in naturopathic medicine, we refer to as obstacles to cure. And in this case, you know, when we are talking about inflammation and let's say diet, two of the easiest things, well, maybe not easy, but two of the categories that we can reduce as much as possible or preferably eliminate is processed sugars and alcohol. In so many ways, alcohol is a toxic form of sugar anyways, and that's how your body sees it. So taking away those, and in how many cases, how many patients have we seen where we really, something as simple as this, again, not easy, but simple, do we not see people's lives just
life-changing,
and really turn around. And also the other thing that I would touch upon on this video is avoiding sedentary lifestyle. Really, and that takes us to this aspect of, so what can we do? What can we add? And that is movement. You know, and we want to, when we talk about this with our patients, we try to stay away from this workout or exercise genre as we know it. And a lot of people might not, some people love it, but a lot of people do not want to commit to that form of rigid is the word that I'm looking for, rigid form of exercise. But incorporating or sprinkling in movement throughout the day into your life, it can improve your physical health, it can improve your mental health, and your emotional health. I mean, there really is not a shortage of literature on just looking at the value of movement or quote unquote exercise and as a form of antidepressant without any side effects.
Absolutely. So get out and move your body.
Yes.
And lastly, we wanted to talk about a little bit about what you can do from a dietary standpoint, from a lifestyle standpoint, to start to reduce your inflammation. And one of the best tests that we have in our arsenal to be able to help people with this kind of reducing inflammation is a food sensitivity test. This basically looks at your individualized reactions to food and how it may be leading to the symptoms and the chronic diseases that you may have. So next time, we're going to be talking all about food sensitivity testing and giving you more information on this and how you can go about doing this testing with your doctor. So stay tuned.
Yes. And also, that test actually helps you personalize your diet.
Absolutely.
Because what might be good for you might be a kryptonite for me and not so good, and vice versa.
Very true.
And as always, please take a minute to share this video. If you're finding the information useful, share it with the people that you love and care about and know can benefit from the information that we share as well.
Yes.
And we
So
look
thank
forward
you so
to the
much.
next one.
Thank
Yes.
you.